Hello everybody, this is Sharon Paulier, your instructor for the Fundamentals of Health Informatics course. Today we're going to go into our last module, Module 8, and we're going to talk about some fun stuff like hardware, cows, wows, tablets, smartphones. So let's get started. I'd like to start by giving you an overview of what we're going to talk about. And I just want to say that within any hospital there are many types of hardware that's used. We have cows, as they're known, or computers on wheels, also known as wows, I'll get into that a little later, called workstations on wheels. We use label printers, prescription printers, scanners, document scanning, laptops, as well as new technology like the iPads, the iPhones, Androids, and any other types of smartphone. So cows and wows, what's all the fuss with all this? What's a cow? So a cow is a term you probably hear within a hospital. It's a computer on wheels. It's just what it says. It's very functional. It allows nurses to walk from room to room and have their workstation with them. But several years ago, this became a discussion within hospital settings where some people found that not an appropriate term. So now it's called a WOW, a workstation on wheel. They are synonymous, they mean the same thing, but it's, I guess, politically correct to call it a WOW instead of a cow. It is basically a laptop or a PC mounted on a cart with wheels. Like it says, it's very mobile. It's mainly used by nurses going from room to room when they're documenting on an EMR. It's just, it's a great tool for nurses and for documenting immediately. Now let's talk about some of the advantages and issues concerning the wows or cows. So some of the advantages are cost. Instead of having a PC in every room to document, one wow per nurse can move from room to room. It's more cost efficient. The immediate access to information on the chart. You can access the EMR from anywhere. The wows are all over the units. And patient satisfaction. When you document at the bedside, that equates to more time directly with the patient. Patients like that. But there are also some issues that come along with the wows. One main one is battery life. Although they still work on this, and you plug a wow in and keep it charged, but to be mobile you have to rely on the battery. So they do have their own batteries on each wow, but then it becomes an issue of whether the battery's too heavy or they have new lighter weight batteries, but they can only usually stay charged for a few hour battery life before they need to be recharged, which presents the next issue, which is fire codes. Often the wows are left in the hallways where they're not supposed to be and blocking doorways or hallways, or they need room to be charged, and this becomes a fire code to the hospital, and this is not a good thing. And also just the security factor. If left unattended, unfortunately, they can walk out the door, which is not something you want. Now, I know several places where they tag them, so an alarm would go off if something like that happened. But it is a security issue nonetheless, and and just tracking where they are as well. Another solution some hospitals use is a kiosk approach. This is a picture of what a kiosk is. Instead of having a wow where the computers going from room to room, these are set up actually like in central locations with easy access. So they're used mainly in the hallways and little kiosk areas, or you can keep one in every room as well. They take up less room because of the keyboard usually folds up when not in use, so it is a space saver as well. Now let's talk about some other equipment that's used with the EMRs. In addition to the wows and the kiosks, we also use other ancillary items such as a signature pad, When documenting electronically, patients often need to sign forms. So these electronic type forms require a signature, thus the need for a signature pad. We also have scanners. Often, when you're a registrar, when you're being admitted in an admission area, they're collecting information such as insurance cards, IDs. These are often copied. Now items are scanned into the chart, so they don't have to be done each time the patient comes into the hospital. They're scanned directly into the chart one time. They sit at the medical record level rather than at the visit level, and they're accessible to anyone who needs them. Next, digital cameras. This is a new wave of the future where now many of the electronic medical records have photos of the patients as they're registering the patient, and they're using their signature pads and their scanners. They're also taking a quick picture of the patient, and it's uploaded directly into their electronic medical record. You know, you can imagine all the benefits that has. Now let's talk about tablets and smartphones. What's all the hype with them anyway? Well, the main thing is that you can use them anytime and anywhere. Most EMRs boast this type of functionality. They even have apps for them. The physician on the golf course or on vacation needing to order a medication for his patient, this is phenomenal. And likewise, the same clinician has accessibility to the patient's charts and what's going on with that patient, whether they're there on site or home or anywhere. Now let's talk about some of the functionality. Specifically, we'll talk about the tablets. Today, most physicians own an iPad or a tablet or something along that line. Reason being, they're very mobile and they're easy to carry around. Often you can stick them right in your lab coat. Hospitals are buying them for their physicians as well. There's a high acceptability factor. They use wireless networks just like the smartphones do, whether it's 3G or 4G, and they can be used for other applications as well. Some of the disadvantages, though, are infection control issues. This is a big issue in any hospital. They're difficult to sanitize. Also, as easy as they are to use, they can't be used with surgical gloves. You need to make contact, and because they are glass, they often can break more easily. If they drop, they're gonna break, unfortunately. And as I mentioned previously, most people today, as we all know, do own a smartphone. It's certainly the wave of the future, and whether it's an iPhone or an Android, there seems to be an app for everything, including most of the EMRs. So many of the big EMR companies have an app that you can download right to your phone. So this is great technology and much needed technology. Lastly, I'd like to talk about Dragon, which is voice recognition software, versus transcription services. So I'm sure many of you know what a transcription service is. Many physicians like to dictate their notes. When they do that, it's often sent out to a transcription service to come back with the report. This is very costly and can be time consuming. They need to be sent out, they need to be transcribed, and then sent back. The advantages of using Dragon are it is a software product. It's speech recognition software, and it turns talk into text. This is very cost efficient, it's very simple, and it's quick. It happens on the spot. It often works hand in hand with many of the EMRs, and the main functionality is actually with the PAC system. So many radiologists, when they're viewing an image, they need to create a report, based on that image, and they're transcribing what they see. And they use Dragon to do that report. So it's a big help, and like I said, it's a big advantage. Anyway, this concludes not only Module 8, but it concludes the course for healthcare informatics. I hope you all enjoyed it. I'd appreciate any feedback via email or the discussion board, and thank you all very much.